Oh no! Oh, my hamstring! Oh no! Today we're going to talk about the most common injury that we see in soccer players. This is called the hamstring strain. So what happens when somebody strains their hamstring is they get pain in the back of their leg, and this pain is typically classified with different grades. So we're going to get into all the details about this, talk about ways that we prevent it, and then also some things that we do in our clinic to rehab a hamstring strain. So hamstring strains are classified as 3 different grades. A grade 1 is there's no tear in the hamstring at all. The hamstring was just overstretched or over-lengthened, and it's irritable tissue. A grade 2 hamstring strain is where there's a partial tear within the tissue. And then a grade 3 is a complete tear where the hamstring or part of the hamstring is no longer attached at all. The grading system is extremely important because it helps to identify prognosis or how long it's going to take for somebody to recover. And then it also is important in determining how conservative we have to be with our rehab. If we're too conservative with a low grade issue, it'll take longer for it to get better. If we're too aggressive with a higher grade issue, it may not get better at all and actually may get worse. So grading is extremely important, and there is a strict system that we have to follow in order to grade appropriately. Let's talk about the key components of a sound rehabilitation program for a hamstring strain. So the first thing is to be cautious with stretching. Sometimes the sciatic nerve can actually get irritated with a hamstring strain, and if you stretch it, you can actually cause more irritation. So if stretching is causing more pain rather than just tightness, it's not a good idea to push through it. Also, if you're feeling more of like a tearing feeling than just a tightness or a pulling, you could be doing some damage. So you have to be super cautious with stretching because you don't want to overstretch it, especially since the mechanism of the injury was likely too much tension on the hamstring. Next, we want to strengthen it. Now, it's really important to strengthen appropriately. Sometimes we have to do isometrics, where we actually don't move the hamstring muscle at all to load it and make it stronger and more resilient. Other times, we can start at the concentric phase, where you're moving it through a full range of motion. And then towards the end of rehab, we get into heavier weights, and then we eccentrically load it, whereas we're lengthening the tissue under tension and with time. So strengthening is probably the cornerstone to this program. The next thing that we do is we will start a gradual return to sprinting. Gradual is extremely important. You can't just come out sprinting right after a hamstring strain. You're going to re-injure it. You have to build up. So you start at maybe a light jog, you build up to 25%, 50% intensity, 75%, and then you finally end at 100% all-out sprint. But you have to do this over the course of many weeks. It's not something that you just do gradually in one session or over one day. And then lastly, dry needling is another thing that we add to our care. We go into the different hamstring muscles, depending on which one seems to be the primary pain generator. We find little muscle knots. We place the needle within there, and sometimes we'll do a little bit of movement with the needle, but our goal is to hit some of those trigger points or muscle knots to release some of the tension, create a little bit of local tissue damage, and get that hamstring to heal up a little bit more quickly than it would on its own. We're going to talk about 2 exercises that we use to help rehabilitate hamstring strains. The first one is a single leg RDL. Now again, this is not medical advice, so if you're having pain with any of this stuff, make sure that you seek out a provider. But the way this exercise works is you're going to have one plant leg, you're going to have a kettlebell or dumbbell in the opposite hand. The key here is you're going to not allow your back to round, have a slight bend in your knee, and then you're going to hinge at the hip and bend forward. You're going to feel some tightness in the back of your hamstring. That's normal. Once you feel that tightness, you come back up. If it's not painful when you do this exercise, then you can do this with a little bit of weight. So you'd start with the weight up top. If you're struggling with your balance, you can also keep that back foot planted, just like this. So slight bend in the knee, arch in the back, bending forward, feel the tension, come on back up. So if you have a hamstring injury, you're not going to be able to build up a ton of tension, and that's completely normal. It's going to get more loose as you do more repetitions and you get stronger over time. So the next exercise we're going to talk about is called a bridge walkout. Now there's a couple variations, so I am going to demonstrate a progression. So to start out the bridge walkout, you're going to lay flat on your back, squeeze your glutes, don't pull with your back, just squeeze here, lift up. You're going to hold that position, you're going to walk your legs out. The further you go, the harder it gets, and then you're going to bring them back in. Okay? If you want to make this a little bit more challenging, you can walk out, then you can straighten one leg. This is an isometric hold. Or if you want to make that even more challenging, you can hold that, and then you're going to drop the hip and then raise the hip back up. All these progressions from easy to hard help to load the hamstring tendon and then help strengthen it back up. If you're having pain with any of these, like I said, consult a medical provider to make sure that you're getting the care that you need. If you have any other questions, drop them in the comments.